Hi, my name is Janabu. I'm going to be a nurse today. Can you please identify your first and last name for me and date of birth?
My first name is Jeffrey Muse. My date of birth is 3/16/97.
Okay, before we get started, would you like some privacy?
Yes.
Okay, sir. Um, I'm here to conduct a head-to-toe assessment on you. It obviously requires me to touch you, so do I have your permission to touch you?
Yes.
All right, perfect. Do you know where you are right now?
Yes, I know I am. I'm in Boston.
Do you know what today's date is?
Yes, today is April 28th, 2020.
That's perfect. Are you in pain?
No, I'm not in any pain, miss.
So the patient is alert and oriented times 3. He is sitting comfortably erect. He maintains a good eye contact. He is well dressed for the occasion. He's well nourished, well groomed. The patient states that he's in no pain. And yeah, we assessed the patient's vital signs and they were all in normal limits. We obtained his BMI through his weight and height, which were also in normal limits. Now I'm going to start the assessment of the skin. So can you please raise your arms up? So looking at the patient's skin, it is even and consistent with genetic background. There's no lumps, bumps, or erythema, freckles, moles, bruises, cuts, or lacerations. Now I'm going to check the temperature using the back of my hand, and the skin is dry and warm. And now I'm going to check for the skin tuber, pinching it. It's mobile, meaning that it's not tenting. Now I'm going to move on to the assessment of the nail. May I see your nail, sir? Looking at the nails, it is clean, clear, translucent. Contour is less than 160 degrees, meaning that it's not clubbing. The edges are appropriate to size. So now I'm going to do the capillary refill. Which are all less than 2 seconds. Now I'm going to move on to the hair, head, and scalp. Looking at the patient here, it's black. The texture is soft, curly, shiny. Looking at the scalp, it's a pinkish color. There's no lice, lesions, cuts, or bumps, or any other infestations. While I'm palpating the patient's head, it's normal cephalic. There's no bumps, lumps, any sorts of masses. When I'm palpating your head, do you feel any pain, sir?
No, miss.
That's perfect. Now I'm going to start the assessment of the patient's face. Looking at the patient's face, it's symmetric, as well as the eyes, eyebrows, ears. The nose is midline to the mouth, which is also symmetric. Now I'm going to palpate the temporal arteries, which is 2 plus bilaterally. I'm going to palpate the frontal sinuses and then the maxillary sinuses. Do you feel any pain or tenderness?
No.
Okay, that's perfect. So now I'm going to do the cranial nerve 5 motor feature. So can you clench your jaw for me? I feel the masseter and temporal muscles clench up equally, so that tells me that the cranial nerve 5, the motor feature, the trigeminal, is intact. Now I'm going to do the sensory feature of the cranial nerve 5, which is again is the trigeminal. So by doing that, I'm going to have the patient close his eyes and please identify where you're feeling this cotton, okay?
Forehead, left cheek, chin, right cheek.
So the patient was able to identify where he can feel the cotton, which tells me that the sensory feature of the cranial nerve 5, which is the trigeminal nerve, is intact. Can you smile for me? Can you frown for me? The patient's smile and frown are symmetric, which tells me that the cranial nerve 7, the facial nerve, is intact. Now moving on to the patient's eyes. Looking at the patient's eyes, the eyebrows, eyelashes, papillary fissure, and eyes are all symmetric. The hair and the eyelashes and eyebrows are going in one direction. Now I'm going to palpate for the lacrimal apparatus. There is no excessive tearing. The puncta, there's no swelling. Do you have any pain, sir? Alright, so now I'm going to lower the patient's lower eyelid. The conjunctiva is pink and moist, no drainage, and the sclera is white. Now moving on to the cranial nerve 2. The cranial nerve 2 is known as the optic nerve, and we test this by doing the visual field test, which is also known as a confrontation test, and also the visual acuity test. So we did the visual acuity test, and the patient presents a 20/20, meaning that he can see objects at 20 feet, while other people can see at 20 feet. So now we're going to do the visual field test. So, sir, can you cover your right eye for me? And tell me when you can see my fingers, okay?
I can see it. I can see it. I can see it. I can see it.
Alright, can you cover your other eye for me?
I can see it. I can see it. I can see it. I can see it.
So the patient's peripheral vision and cranial nerve 2, which is the optic nerve, is intact. Now moving on to the Perla test. The Perla test tests on cranial nerve 3, 4, 6, which is the oculomotor, trochlear, and the abducens. So first I'm going to start off with the pupils. So I'm going to look at the patient's pupil. So the patient's pupil constricts directly left, and then the right pupil constricts consensually. Now I want to do it on the other side. The right pupil constricts directly, and then the left pupil constricts consensually. Now I'm going on to the accommodation. So, sir, can you look at the wall behind me and then look at this pen light, okay? So look at the wall and look at the side, like pen light. So I can tell that the patient's eyes move together and converges, and the pupil constricts, which tells me that the pupil is equal round as well as the eyes. The eyes is equal round, and the pupil restricts to light and accommodates. Now I'm going to do the 6 cardio field. So can you follow the pen light just with only your eyes, okay? So the patient was able to move his eyes together, and there was no nystagmus. So all these tests tells me that the cranial nerve 3 and 4 sex, again, is the oculomotor, trochlear, and the abducens are all intact. Now moving on to the patient's ear. Looking at the patient's ear, there is no swelling, redness. It's appropriately placed on the head. Now I'm going to palpate the auricule and the tragus. Any pain or tenderness?
No.
Okay, now I'm going to visually inspect the patient's ear by pulling the peanut up and back. Looking inside, it's clean, clear, no drainage, no foreign objects, redness, swelling, lumps, or bumps. Now moving to the other side of the ear, doing the same thing. Pulling the peanut up and back. Clean, clear, no drainage, foreign objects, lumps, bumps, redness, or swelling. Now I want to perform the whisper test on the patient, which tests for the cranial nerve 8, the acoustic nerve. So can you please cover your right ear for me and repeat what I say?
Just do it.
Alright, can you cover the other ear for me?
I really will.
Alright, so the patient was able to repeat what I said to him, which tells me that the cranial nerve 8, which is the acoustic nerve, is intact. Now moving on to the patient's nose. Looking at the patient's nose, the placement in skin is consistent with the face. I don't see no lumps or bumps externally. Can you please lift up your nostrils for me, sir? Now looking in the nasal mucosa is pink and moist, no redness or swelling. The nares and septum has no deviation and turbulent. Now I'm going to assess for the cranial nerve 1, which is the olfactory nerve. Can you smell these 2 things for me? But can you close your eyes first and tell me what you smell, okay? Coffee.
Oregano.
Alright. The patient was able to tell me what he was smelling, which tells me that the cranial nerve 1, which is the olfactory nerve, is intact. The purpose of this is to test for the patency of the nares. Now moving on to the mouth. Sir, can you smile for me? Can I see your teeth and gum? So looking at the patient's teeth and gum, the teeth is way straight and intact. The gum is moist and pink. No redness or swelling. Can you open your mouth for me? So the hard and soft palate and the buccal membrane are moist and pink. There is no redness or swelling. Can you lift up your tongue? I'm looking at the patient's floor gum. It's also moist and pink. There is no lumps, bumps, or any sort of lesions. Can you stick out your tongue for me and say ah? So I see that the uvula in the soft palate rise to the midline, which tells me that cranial nerve 9 and 10, which is the glossopharyngeal and the vagus nerves, are all intact. Can you stick out your tongue for me and have it stay in place? So I can tell that the patient was able to do that, which tells me that the cranial nerve 12, which is the hypoglossal, is intact. Now I want to move on to the assessment of the neck. Looking at the patient's neck, it's symmetric on both sides. The skin is consistent with a genetic background. There's no bruises, lumps, or bumps. I'm going to palpate the trachea in the midline, which is okay in the midline. Next, I'm going to palpate the nose, so the preauricular, postauricular, occipital, segmental, submandibular, the posterior clavicular, the jugulogastric, the deep clavicular, and superficial clavicular. Can you shrug up your shoulder and then the supraclavicular? So I did not, the notes were not palpable. Did you feel any tender pain?
No.
Okay, good. So now I'm going to assess for cranial nerve 11, which is the spinosus accessory. So can you turn your head to the left? Okay, can you do the same thing on the other side? Can you shrug your shoulder for me? So the patient was using his muscles against resistance, which tells me that cranial nerve 11, again, is the spinosus accessory is intact. Now we're going to do the range of motion. So can you put your head down, to the left, to the right, side bend, side bend. Can you tilt your head up to hyperextend? So the patient has a full range of motion on the neck. Now I'm going to palpate for the thyroid, so can you face the other way for me? Can you put your head down to the left? Swallow. Do the same on the other side. Swallow. So while palpating the thyroid, the cycloid process moved up, and I did not feel any lumps or bumps of the thyroid. Now moving on to the thorax. Can you please face back where you were? Upon inspection, the patient's skin is homogeneous. I did not see any bumps, lumps, or any rashes, bruises, or masses. Scapula and shoulder are symmetric. AP diameter is 1 to 2, which is normal. Now I'm going to do the spinosus process starting at C7. Are you feeling any pain?
No, ma'am.
No, ma'am? Okay. So the spine is in the middle. I don't feel no tenderness, masses were not felt, or any bumps. Okay, perfect. So now I'm going to do the thoracic expansion. Can you take a deep breath in? At T9 and T10, the patient's thoracic expanded equally and bilaterally. Now I'm going to do tactile affirmatives. Can you say 99?
99, 99, 99, 99, 99.
So vibrations were felt throughout and equally. Now I'm going to percuss the patient. So Renaissance was heard throughout. Now I'm going to osculate posteriorly with my diaphragm right here. All right, let me do it here. Breathe in and out, sir. And I would have continued here, 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 and here. So the sounds were clear and there was no adventitious sound heard at 3 levels. So can you move back where you were originally so I can listen entirely? I'm going to do the same thing with my diaphragm. So breathe in and out. And I would have continued here, 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 and here. So again, there was no adventitious sounds and it was clear. Now moving on to the heart and neck vessels. At this time I would have the patient at a 30-degree angle. Now I'm going to inspect the external jugular vein. So can you move your head to the left, to the right? Noted that there's no distension. Now I'm going to palpate the patient's carotid artery. Sorry. It's 2 plus. 2 plus. So both the carotid artery was 2 plus bounding bilaterally. And now I'm going to, listen with my diaphragm with the angle of the jaw, the middle clavicular, and the base of the neck. And I'm going to do the same thing with the bell, angle of jaw, mid-clavicular, and base of the neck. No breeze were not heard, and I do the same thing on the other side. So with the diaphragm, angle of jaw, mid-clavicular, and base of the neck, and then I do it with the bell, angle of jaw, mid-clavicular, and base of the neck. Alright, and again, no breeze was heard. So now I'm moving on to observing the precordium. Looking at it, the skin is consistent throughout the body. I don't see any lifts or heaves. Now I'm going to palpate. There are no thrills or any abnormal pulsations. Now I'm going to palpate the PMI, which is located at the mid-clavicular 5th intercostal space. Can you breathe in and hold your breath for 2 seconds? Okay, so I palpated the PMI, and again, it was located at the mid-clavicular 5th intercostal space, and it was palpable. Now I'm going to osculate the PMI in the direction of 8 times using the diaphragm first. So first I'm going to start off with the aortic, which is on the right 2nd intercostal space. Then a pulmonic, left 2nd intercostal space. Erb's point, 3rd space intercostal on the left. The tricuspid 4th intercostal space on the left. And then I'm going on the mitral, which is the 5th intercostal space on the left. Now I'm doing the same thing again, but with the bell backwards. So the mitral 5th intercostal space on the left. The tricuspid 4th intercostal space on the left. Erb's point, 3rd intercostal on the left. The pulmonic, 2nd intercostal on the left. And then the aortic on the right 2nd intercostal. So I could hear S1 and S2. They were clear. I did not hear any extra heart sounds. Alright, so yeah, so S1 and S2 were heard. So now I'm moving on to the abdomen. At this time I would have the patient in the reclining position. So first I'm going to inspect the abdomen. It's even. The skin is even in contour. It's smooth. I did not notice any lumps, bumps, masses, or any bruising or rashes. Now I'm going to osculate with my diaphragm of any bowel sounds starting from the right lower quad, right upper quad, left upper quad, left upper quad, and this one is the left lower quad. So no hyper and hypoactive sounds were heard. Now I'm going to do vascular sounds using the bell. And I want to listen to if there's any breeze. So now I'm going to go 2 inches up from the umbilicus to listen to the aortic. To the left is the left renal artery, and then the right renal artery. So going 2 inches below the umbilicus, to the left is the left iliac artery, and then the right iliac artery. Listening to these arteries, there was no bruit heard. Yeah. So now I'm going to percuss the patient, percuss the abdomen. Okay. So starting from the right lower quad to the right upper quad, left upper, and then the left lower. Tympany was heard throughout. If I was supposed to percuss over the liver, which is located at the right upper quad, it would have been dull. Now I want you to do a light palpation with 3 fingers. So starting with the right lower quad, let me know when you're feeling any pain or tenderness, okay? Any pain or tenderness? Okay. Right upper quad, no pain or tenderness. Left upper quad, no pain or tenderness, no. And the left lower quad, any pain or tenderness? No. Okay. So the patient states no pain for any of the quads. While palpating, I did not feel any masses. It was non-tender. Sorry about that. So now moving on to musculoskeletal, we're only going to be doing the upper and lower extremities. So looking at the patient's upper extremities, the skin is even and consistent with a genetic background. I did not see any moles, freckles, or rashes. Now I'm going to assess for the temperature. The skin is dry and warm. Now I'm going to palpate the patient's pulses, brachial, radial, and ulnar. They were 2+ bounding bilaterally. I'm going to do the sensation test. So can you please close your eyes for me? So, and let me know when you can feel sharp or softness, okay?
Sharp, 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 soft.
So the patient was able to identify which one was sharp and soft. Can you have your arms up for me, please? Thank you. So can you push towards you now? So the patient was able to perform the muscle strength, which tells me that it's 5 out of 5 bilaterally. Now moving on to the lower extremities. Looking at the patient's lower extremities, again, the skin is consistent throughout the entire body. There was no rashes, freckles, moles, cuts, lesions, lumps or bumps. Looking at the tibia, and there is no edema. Look on this side, no edema. Now I'm going to assess the temperature of the patient's skin. It is warm and dry. I'm going to check the pulses. So this is the popliteal, the dorsalis pedis, and then the posterior tibial. They're all 2+ rounding bilaterally. Now I'm going to perform the sensation test on him. So can you please close your eyes and tell me when you can feel softness and sharpness, okay? Okay.
Soft. Hard. Sharp. Sharp. Soft.
So the patient was able to identify where he was feeling softness and sharpness from proximal to distal. Now I'm going to check the patient's muscle strength. So can you push against me? Against you now? Okay. So the patient was able to do the muscle strength, which tells me that it's 5 out of 5 bilaterally. Now I'm going to have the patient to stand up so we can do the range of motion. We're going to skip the neck because we already did the neck, so we're going to go to the shoulder. Okay, are you in the camera? Yeah. So now we're going to lift our arms up to the ceiling for flexion, and then we're going to pull our arms straight down to the side for extension. So we're going to put the arm behind you for hyperextension, and then straight across in the midline for abduct. Now we're going to do a circular motion for circumduction, and then we're going to put your arms back like this. External. This is the external rotation, and then we're going to put our arms behind for internal rotation. So the patient has a full range of motion in his shoulders. Now we're going straight to the elbows. So go straight out to extend, bend arms to flex, extend straight out again, flip over arms to pronate, flip arms to the palms to supinate. The patient has full range of motion of the elbows. Now we're going to bend the wrist down to flex, put hands flat to extend, bring it up to hyperextend. We're going to radial deviation, and then ulnar deviation. So the patient has full range of motion of his wrist. Now we're going to move on to the fingers. Make a fist that to flex. So fingers straight out to extend. Spread your fingers out to abduct. Clench fingers in to almost to fist is abduct, abduct, abduct. The patient has a full range of motion in his fingers. Now you're going to lift one leg to flex at a 90 degree. Now put one leg down to extend. Move your leg backwards straight to hyperextend. Move leg out to the side to abduct, and then to the midline to adduct. Lift and bend knee again to internally rotate, and then externally rotate. The patient has full range of motion on his hip. Now we're going to the knee, so flex your knee up, back and straight back down to extend. The patient has full range of motion in the knees. Can you sit back down so we can do a range of motion on your ankle? Looking at your ankle, can you lift leg out and have foot flat and tilt toes towards nose for the dorsal flexion? So can you please point your toes to the floor for plantar flexion? Range of motion of the ankle for inversion. So inversion and then exversion. So the patient has a full range of motion on his ankle. Now we're moving on to the narrow reflex. I am going to support his arm. I'm going to put my thumb over his antecubital area. I'm going to find the tendon, and then with the hammer reflex, I'm going to hit it where my thumb is, and I should feel the fingers. Move. So flexion is felt in. Yeah, the flexion is felt. Now I'm going to do the brachioradial. Same thing. I'm going to find the tendon. I'm going to hit the hammer over that tendon, and flexion was felt. Now that was the bicep reflex. Now I'm going to move on to and that was also the brachioradial reflex. Now I'm going to move on to the triceps. I'm going to use it with this. because I think you put this. I want to have the patient, can you relax your arm for me? Thank you. With the tricep reflex, I'm going to find the elbow 2 inches up the tendon. I'm going to use the hammer and flexion should be felt. So flexion of hand and finger was noticeable, so that means the flexion was felt. Now I'm going to do the tricep. With tricep reflex on the patient's, no, excuse me, I'm going to do the plantar tendon. Okay, so can you lift your legs out for me? Alright, so with the plantar tendon, lightly pulling my knee, like the knee up. Now I'm going to tap with the hammer, and flexion should be felt. Okay, flexion was felt. Now I'm going to do the Achilles tendon. So I'm going to move. So I'm going to have the patient move out his leg and hit behind, and flexion was felt. Now I'm going to do the Babczynski test. So let me see the full sole of your foot. Can you flex your knee for me? So I'm going to make her upward J, and the toes curls, which tells me that the Babczynski is negative and 2+ bilaterally on each side. All right. So next I'm going to do the sterogenous. So can you close your eyes and tell me what you feel in one hand and the other? So can you tell me what's in this hand?
Paperclip.
Okay, it is a paperclip. In this one?
Marble.
Okay, both. The patient was able to identify what he was feeling. Now I'm going to do the graph anesthesia. So can you close your eyes? And I'm going to draw something, okay? And let me know what it is.
8. 5.
So the patient was able to identify what was drawn in his hand. Can you stand up for me so we can do the Romberg test? Can you please? All right. So I'm going to protect the patient from falling. We're supposed to be doing this for 20 seconds. Swaying is normal, but however, the loss of balance isn't. So after 20 seconds, I can tell that the patient was able to perform this. Can you move the chair for me, please, sir? All right. So can you walk down the hall? I'm watching for smoothness and gait and gait. Okay, can you walk back heel to toe, heel to toe? All right, can you do that again? Heel to toe, heel to toe. Can you please walk on your tippy toes? Now walk on your heels. The patient gait is smooth and even and without assistance or deviation from walking. So can you please sit back down? So, sir, this concludes the head-to-toe assessment. Do you need anything?
No.
Do you have any questions for me?
No.
Thank you so much for helping me. Thank you.